In fact, 50% of men 50 years or older have some degree of erectile dysfunction. And even in younger men in their 20s, 30s, and 40s, at least a quarter of younger men have erectile dysfunction. There are all sorts of supplements and vitamins promising to get you better erections. But I want to talk about an evidence-based action you can start doing today to help you stay hard longer. Okay, urologists like me know all too well about erectile dysfunction. It is one of the most common complaints that we see and a large part of the content on this channel. In fact, 50% of men 50 years or older have some degree of erectile dysfunction. And even in younger men in their 20s, 30s, and 40s, at least a quarter of younger men have erectile dysfunction. So it's no surprise that so many penis owners are looking for solutions. There are all sorts of supplements and vitamins promising to get you better erections. But I want to talk about an evidence-based action you can start doing today to help you stay hard longer. Let's get into it. We know that there are treatments out there for erectile dysfunction. There are pills, there are injections, there are newer advances coming out, shockwave therapy, even Botox for penile erections. I know. If you haven't seen my videos on these, check them out. What if you want to do something today that isn't a prescription, isn't a procedure? What, doctor, can I do that is really going to help me either prevent erectile dysfunction or help me try to treat my erectile dysfunction? Here is an evidence-based action based on research that you can start doing today to help you get hard, stay hard longer. And that secret is get moving. Exercise. Yes, I know. Don't want to hear this. Keep saying it. Why is exercise always the answer? It's because it's the truth, okay? And there is now really good scientific evidence about erections and exercise. So a meta-analysis of 11 randomized controlled trials was published in the Journal of Urology last year in 2023. And it looked at exercise and erection scores as reported by men using a validated international questionnaire. Now, this meta-analysis included a total of 1,100 men across these studies, 600 of which were assigned to exercise regularly, at least 3 times a week, and 500 of which were assigned to no exercise. Before I get into the results, I want you guys to understand what a meta-analysis is, randomized control. Meta-analysis is basically an analysis of multiple studies, okay? Looking at multiple studies out there and kind of making and summarizing it. It's a great way to put all the evidence together from individual studies. Now, randomized means that in the study, the participants were randomly selected to either get the intervention, in this case exercise, or the control. In this case, no exercise. Sometimes the control is placebo. Sometimes the control is some standard of care that we already know works, and we're putting that up against the intervention, all right? So randomized controlled trials are great because it's random and it's putting it up against something to compare. So the analysis found that consistent aerobic exercise significantly improved erection scores. And that's not even the most significant finding for me as a urologist. The most interesting finding was that the best improvements, the greatest improvements were seen in men who had the worst erections, who had the most severe erectile dysfunction. That's huge. That means even in these patients that have severe erectile dysfunction, exercise may prove to actually help. In fact, improvements in erections with exercise in this severe group was comparable to improvements seen with medications like Viagra. With this data, urologists like me should probably be emphasizing and recommending regular exercise even more so than we do, even in our patients who have severe impotence or erectile dysfunction. Like, exercise should be on the prescription pad. 3 to 5 times per week, get some exercise. That's your treatment, okay? If you're interested, I'll put the reference to this meta-analysis in the notes below. Exercise should increase your heart rate, and it should be at least 45 minutes, at least 3 times per week, ideally. I think this is really encouraging news. It means that the patient has the power to start moving their bodies and start trying to make a difference in their sexual health. It also emphasizes how important physical activity is for your overall cardiovascular health. Remember, the penis is a reflection of the heart and the rest of your blood flow. All right? Getting your body moving consistently is better for your heart and therefore better for your erections. The key is consistency. So let me know what you think below. I love reading your comments, but more importantly, make sure that you are subscribed so you can get all of the tea down there right here.